So just to recap from the previous video, herpes simplex versus herpes zoster, keratitis, both are going to present with more or less similar signs and symptoms. Patients are going to have painful eye, red eye, tearing, discharge, photophobia, photosensitivity. In herpes zoster, you can have lesions also, so that's why very important to have the patients take off their mask so that you can see what is going on their face. Sometimes I've seen lesions on their scalp, also on the arm, forearm, so you have to be careful with that. If they're active oozing lesions versus inactive crusted lesions, be careful with the hygiene in the exam room and ask the patient to have very good hygiene also, because it can be contagious in the active stage. In the herpetic keratitis, a lot of times be careful, other nerves can be involved. In herpes simplex versus herpes zoster, trigeminal neuralgia, you must have heard of it, which is painful face symptoms, and it's a trigeminal nerve, which is the fifth cranial nerve that can be involved, because it has three main branches. One goes to the eye, which is known as ophthalmic division, then one goes to the face, two actually go to the face, the maxillary branch, and then the mandibular branch. So remember that seventh cranial nerve can be involved, which is the seventh cranial nerve, facial nerve. Ninth nerve and 10th nerves can be involved as well. We're not going to go into the detail of all of that because we're just trying to focus on the herpetic keratitis. The treatment for both of them that I do is called an antiviral oral pill, which is acyclovir. Usually I do 800 milligrams 5 times a day for 10 days. Okay, again, 800 milligrams 5 times a day for 10 days.